Well, good afternoon, everybody. Now I know the issue du jour is obviously what's going to happen later this afternoon, this evening, particularly with some of our relentless focus on the tax credits, the ACA tax credits. But what we're here to talk about today is actually an additional front on what seems to be a uniform and united attack from President Trump, his administration, and congressional Republicans to cut back on the affordability and availability of Americans' health care. I've seen it in my state, in the reactions to the big awful bill, where we have hospital systems literally shutting down rural health care clinics already. Not in the future, not imaginary, but directly attributing it to the consequences of the big awful bill. We've seen it on the efforts to gut outreach efforts, to gut enrollment assistance, and we obviously are now further debating the absolute disaster that's going to roll out at the end of this year with the expiration of the premium tax credits. And I would point out on that, we're also starting to see, I think, efforts from the administration to delay the letters going out, to hide the fact of these enormous rate cases. I can tell you in Virginia we've looked at examples where a couple making, folks in their 60s making $80,000 a year in Virginia Beach could see premium increases of $800 a month. Outrageous. And, on top of that, I just think one of the things we need to do a better job at is, whether it's the Medicaid cuts or the premium tax credits, this is not going to just affect those folks. You add this many folks to the uninsured pool, and spent a lot of time on this as a former governor, it is going to drive up rates for everyone. This is a wholesale attack on health care. The issue Senator Wyden and I are going to talk about today is actually a rule that came out from the Trump administration in June. And certain entities have brought it to court. There was some restraining order put today, but it is going to be devastating. The so-called Trump administration, or the Trump's administration's so-called marketplace integrity and affordability rule that came out in June, I can assure you, is anything but. This rule will actually throw up more bureaucratic barriers, add more paperwork costs, and keep families from staying insured. What I want to cite before I turn it over to Ron is, don't take my word for it, please. Do not take my word for it on these charges and these claims. Look at what the Trump administration itself has said about the rule. According to CMS, this rule would raise premiums for working families by about $3 billion a year. Millions of Americans would see their premiums and out-of-pocket costs rise literally on an individual basis by hundreds of dollars. And up to 1.8 million additional folks could lose their coverage. Now, that's not from the Senate Finance Committee. That's not from me. That's from the administration's own estimates. For example, one of the bureaucratic hurdles they're putting in place with this new rule would add more than 15 million hours of red tape and paperwork, both for folks who are doing the enrollment, and a state like mine sometimes comes into the local government, but also obviously from the families that are trying to re-enroll. They would put additional charges on place and would put just a lot of bureaucratic barriers. That's why Senator Wyden and I and more than 40 of our Democratic colleagues are introducing this Congressional Review Act. And we will be bringing it up over the next few weeks, regardless of how the current debate goes. But our CRA amendment, and we've heard from my Republican colleagues concerned about this, but it would reduce premium and out-of-pocket costs. It would lower the annual out-of-pocket limits by up to $900 for families with ACA or employer coverage. It would eliminate the new re-enrollment fee, and it would, at the end of the day, just continue to provide the access. It has taken us a long time to get where we are on the ACA. There's always areas to improve, but to kind of put these bureaucratic hurdles in place, and that's before you even talk about the Medicaid cuts, or even before you talk about the premium tax credit expiration, is evidence that, this administration is dramatically trying to cut back on Americans' health care coverage and drive up their costs. It's a pretty simple argument, and we'll have an opportunity to present that to our colleagues over the coming weeks. With that, I'll turn it over to Finance Committee Leader Ron Wyden.
Thank you, Senator Warner, and everybody should know that Senator Warner has been the leader on this issue, and it is a particularly important one. To feed and satisfy the billionaire appetite for tax breaks, it wasn't enough for Republicans to gut almost $1 trillion from the Medicaid program. So now, Republicans are jacking up premiums that Americans pay for health care. At the same time, behind the scenes, and Senator Warner and I have really focused on this because we want to squeeze the inefficiencies out of American health care. Donald Trump and Dr. Oz have been using smoke and mirrors to kick eligible Americans off their health coverage, raise costs, and inflict an extraordinary array of bureaucratic hoops and hurdles and absurdities in the process. The agency that oversees the Affordable Care Act, the Centers for Medicare and Medicaid Services, has proposed changes to how the American people would sign up for health care. And this is something I've focused on since my days as co-director of the Oregon Gray Panthers, because you can always get a sense of people's motives about whether they're interested in having something that works and streamlining the bureaucratic red tape, or go ahead with even more, which is what the Republicans did in the big budget bill. Now, specifically what they do, and Senator Warner touched on this, they increase out-of-pocket limits, create new fees, and generally import the worst tactics, the very worst tactics, from the for-profit health insurance companies. By the Trump administration's estimates, the changes will result in 1.8 million Americans losing their health care next year, and the hours and hours of unnecessary paperwork is going to take a huge toll, and we continue to see analysis indicating that it's greater than people think. So that's why Senator Warner and I are taking action on this very specific lane, and understand this is not what the debate is going on for the next 11 hours, and hopefully going to result in something that helps people. This is a separate matter. Senator Warner's proposal is going to allow Democrats to force a vote on the harmful changes that the two of us are talking about, and give Republicans a chance to go on record as wanting to join us in the future to do the right thing. Under the Congressional Review Act, we're going to be able to demonstrate that as American healthcare is at a crisis point, the two of us want to do something constructive when we're facing the largest cut in Medicaid history. So repealing arbitrary, misguided bureaucratic proposals would mark an important first step to getting things back on track. And two United States senators who on the Finance Committee have made it a special focus, and something I've felt strongly about since my early Gray Panther days, of streamlining the system, making it less bureaucratic. We want to use the Congressional Review Act to tackle those issues. And Senator Warner, thank you for your leadership. And one of the advantages of seniority is give him the difficult questions, give me anything softball. But we're happy to take your questions.
Thank you. Yep.
Thank you so much. Regarding the looming shutdown, it sounds to me like Democrats are sort of insisting on COVID-era handouts when obviously COVID is long gone. How is that a defensible position, and why is free health care for illegal aliens seemingly the hill you guys are willing to die on?
One, the premise of your question is factually wrong, and I would urge you to actually look at the law which prohibits any undocumented person from receiving any kind of health care benefits. That is the law. If the Trump administration is not enforcing the law, then I would ask the president. And I also say the president has made repeatedly clear, and this I don't know, I often agree with Donald Trump, but on this one he's 100% right when he said repeatedly, years back when he was not in office, you know, if you got a government shutdown, it's the president's job to resolve that. Well, you got a president of the United States, you got a Republican-controlled House, you got a Republican-controlled Senate. Let's get this fixed. Nobody wants a shutdown. And the fact of the matter is, the idea that you can punt on this question when people are going to start getting their health care increases documented this month in most states. Some are looking like they're trying to hide the ball and push it back. And then they have to sign up next month. That is not an issue that you can punt on. Our Republicans, I think many of them will concur with that, and they'll have a chance. Let's meet us halfway and get this done.
And remember, here's the programs, all the big programs undocumented immigrants are ineligible for. We're talking about Medicaid, we're talking about Medicare, we're talking about the Children's Health Insurance Program, and no Democratic budget proposal has acted to make those programs different and, in effect, make undocumented people eligible. And the reality is this is being used as a diversion because the real issue is cutting people's premiums. And we want to work with people because that's what Americans are talking about. So you make these arguments about fantasies in terms of medical policy, and on all the big programs, Medicaid, Medicare, and Children's Health, undocumented individuals are ineligible.
Yes, ma'am.
Trump said this morning he may do, quote, a lot of firings of federal workers if the government were to shut down. Roosevelt has made a similar threat. Does that kind of affect how you're approaching?
No, listen. We've got lots of federal workers in Virginia. What I hear from federal workers is they've been on a slow shutdown firing since the beginning of this administration. They want us to push back. And the idea, this shows, I think, frankly, particularly with Mr. Vogt, the absolute cruelty of this guy. I mean, he's thinking that these workers, their families, are trading blocks or can be fired willy-nilly. We remember this is, I guess, none of this is totally unexpected since in Project 2025 and repeatedly talked about terrorizing the federal workforce. That he's been effective on. I think we can keep the government open and not raise health care costs. We ought to do it. Again, I've been very amazed at the kind of comments I've got from federal workers who are saying they've been terrorized enough, they want us to push back against this administration.
Can you take the Republicans' word on the tax credit expiration thing? Like, what would satisfy Democrats with that to get their vote?
Again, I'm not, guess what? I'm not going to negotiate. I don't think everyone was going to negotiate in this room, but I'll tell you this. It's more than a little funky that in many states, these numbers are supposed to go out this month, because that's the first time that people are going to say, holy crap, my rates are going up $800 a month. And I think we are seeing states, some places trying to push back that notification. If they were all sanguine about this isn't going to blow up in their face, they wouldn't mind the information going out now.
And you don't negotiate with yourself. For weeks now, we have been interested in negotiating with them. And Senator Warner and I have done a lot of negotiating in the healthcare space. For example, we got a 26-0 vote in the Senate Finance Committee on reining in pharmaceutical price gouging through these PBMs. So this is not something we made up in order to have a press conference 11 hours before the bell goes off. We want to work with people. We've been trying to work with people. We understand the consequences of what happens on November 1st, but we got to be met halfway, and we haven't. Yes.
One of the things that the Republicans are pointing out here, with the Obamacare, or the COVID-19 relief package was fraught with lots of fraud later on, and they're concerned about the Obamacare tax credits and allowing those making up upwards of $600,000. They were included, plus the CBO reports that in 2025 alone, 2.3 million people received credits for which they were not eligible. How do you square that?
Well, we're indicating at every part of this that we're interested in rooting out. We had a press conference on this very place a few months ago, indicating we're willing to root out waste and inefficiency. We're willing to do it. But much of what they have been saying over the last few days, in other words, they're making a big deal out of people who are lawfully present, for example. That's something that they've used as a kind of, buzzword. Well, the reality is refugees and asylum recipients and the like, they're here legally. So let's get down to actual talks about specific cases. And CBO in particular has said that some of the people that they're talking about, they wouldn't characterize as illegal or unauthorized. Yes.
Have you heard from your Senate Republican colleagues about support for your CRA, and when do you expect to vote on the Senate floor on it?
We've got a little bit of timeline now. It's been filed. We have to trigger the clock. I think we've got a couple months. I think we've got some time on this. But listen, there are all of these issues. And I think I've been in every bipartisan gang there's been. If you got rational people sitting down, you can get to a solution. And we have heard concerns, again, kind of rebutting some of the false information out there that this is some, funds for illegal, undocumented folks. Just not the case. The rational ones realize this is going to blow up their states. The CRA specifics we're talking about right now. In Virginia, we've got an independent health marketplace, driven by the insurance companies, others. They are solidly on record against this rule change from June. So I think that indicates. Yes, ma'am.
Regarding rural healthcare, how do you think the Rural Health Transformation Fund is going to impact?
Are you talking about Google?
Rural healthcare?
Rural.
Rural, okay.
Yeah, well, listen, I can tell you in Virginia, we have had announcement already of 3 rural clinics closing due to the awful bill. We have, ironically, in certain areas, other hospitals that have indicated they will close. And what is sometimes frustrating is that the hospital systems will then come in and lobby me. But one system, for example, we had our event across the street because the hospital system was so afraid of offending the Trump administration. But the data, this is the irrefutable part. We can argue back and forth. But communities in my state that voted 75% for Donald Trump are going to take it worse than anywhere else because they are rural hospitals. They depend on Medicaid. They depend on people being enrolled in the exchanges. People get blown off because of the premium increases, they're going to leave the system. They don't disappear. They're going to show up in the emergency room. It will break the bank, and we will see, in my state, at least 6 rural hospitals have been estimated to close. And the irony of this is that these were the communities that frankly, I think voted for Trump because they wanted to lower costs. Well, we've not seen groceries gone down. We've not seen inflation go down. And sure as heck are seeing healthcare costs skyrocket.
I just had a series of town hall meetings in rural Oregon in communities where Donald Trump won by more than 70%. They know that a healthcare wrecking ball is coming right at them. They're seeing it already in terms of workforce issues. I think we're going to have more maternity deserts in this country as a result of this. We're already having trouble funding these crucial kind of programs. You can't have rural life without rural health care, but we are headed in that direction.
Yeah, just one quick thing. Senator Wyden, and I've also worked on this issue. I can't speak to Oregon. I can speak to Virginia. We got wide swaths of our state where you got no OBGYN services at all. And if you ever try to attract resurgence in those communities, if you've got to travel 2 or 3 or 4 hours to get health care to have a baby, your economic prospects are.
Why don't we take one other one? Yes.
So it doesn't seem like your Republican counterparts are signing on to a permanent extension of the ACA tax credits, but is there room that either of you see on, something in the middle, changing the income level limits or a shorter extension than permanent?
I'll just say, been around long, there's enough here, so why didn't even want, when there's a will, there's a way. But I'm not gonna lay out things here. What we have not seen so far is we have an absolutist demand with a meeting with the president literally only 24 hours before the deadline. As a former governor, I would have been laughed out of the room if I'd brought in my Republican-controlled legislature 24 hours before and say, my way or the highway. That's just not the way the system ought to operate.
And remember, this has been the way they've approached this from the very beginning. We didn't have any big open markups and things like that. They just drove this thing through, and healthcare is now the biggest part of the American economy. You would think that you would spend some time working with people like us who've specialized in this area, and we got stonewalled every step of the way. And contrast that with the PBM bill, which involves billions of dollars. We had scores of meetings and open sessions with all sides, and our door is always open. We want people to know we like legislating and doing it in a constructive and bipartisan way. You got to have people to join you. We'll
Thank
stick
you, guys.
around. Thanks, everybody.
Thanks, everybody. This is a multiple use chart.